Welcome back to NTV News First Edition. A shocking new survey has revealed that Canada's music industry is facing a mental health crisis with financial instability, sleep deprivation and substance abuse weighing heavily on artists and professionals. The Soundcheck survey gathered responses from hundreds of industry workers highlighting the urgent need for mental health support in the music scene in this country. To discuss this is Dr. Janine Hubbard with this week's Get Psyched with Dr. Janine. Thanks so much for being here.
Oh, thanks. And what an interesting study.
Well, and it's also interesting that it was just now kind of done. So when you looked at this study, what were your initial thoughts when you read about it, about the survey actually happening and then what it found?
Absolutely. And apparently it's still open to responses. So they are still looking for people in the music industry to participate. But what they have as preliminary results were, on one hand, not shocking, because as soon as they started to think about, well, what is life like in the music industry? It's like, yes, of course, it's late nights, it's, surrounded by substance use, it's high stress, it's like performance stress, it's financial instability. Okay, that makes sense. But then when I saw the numbers that were being reported, particularly in terms of things like rates of depression, rates of suicidal thoughts, definitely high stress. And I sort of thought, okay, why isn't this something we're talking about? I mean, we've had a few very notable musicians here in this province talk about some of the struggles, even when you're really successful, of, life on the road and away from supports and, lack of consistent sleep. And not to mention that forced confinement with, who you might be touring with or traveling with, but also that it wasn't just the performers, that it was the roadies, that it was the crew, that it was, a number of people associated with the industry that evidently are reporting they're really struggling.
And you say it wasn't really surprising when you think about life on the road, life of a musician. But what other things stood out then about this? Because you're right, when you do think about it, you think, and poor food. I mean, they're eating from, gas stations probably, or fast food places all the time. So what should we learn from this? What can we do?
Well, and again, interesting. So one of the things they mentioned were challenges with ADHD, which totally makes sense because I talk about ADHD in the creative arts community all the time. That makes sense. But when you don't have the regular structure and routine and grounding of a home and perhaps a partner or at least your social support, that's going to be problematic. Again, hadn't occurred to me things like, arthritis and physical injuries and all of those other things that are going to wear and tear, but also the harassment, the sexism, the discrimination, and in a really vulnerable place where it's really hard to stand up to some of that because of power imbalances and the financial imbalances. And so some of that kind of made, it started to make some sense in terms of, right, this is... It even occurred to me, I mean, I've heard certainly people talk about the exposure to alcohol because a lot of performing is in the pubs and it's late night, so you're also often missing out on family activities if you're performing locally. But I even think back to the exposure to things like secondhand smoke back in the day. And so even if you were someone who wasn't engaging in any kind of substances, you were still being exposed. The hearing loss and some of that kind of stuff we've heard about before. But this was really putting a pressure on a group that also is then going to have more difficulty accessing mental health services. And that's actually, I was asking you a little bit in terms of like what kind of is organized and out there to support. And unfortunately, we see lots of fundraisers by musicians for other musicians when they run into health difficulties. So you're not dealing with like an extended insurance plan where you can regularly access a counselor, not to mention if you're someone who's on the road. There are regulatory difficulties and you're not working regular hours. So even if you had the means to be accessing somebody, the actual challenge of it is really significant. And like I say, being away from even those kind of social supports to the family, the grounding that might normally help out. So it makes sense, and I'm delighted that they are identifying this as an industry issue and sort of saying, what is it as an industry we're going to do? The additional one that was mentioned was the stress right now of either not being able to travel to the States or not feeling comfortable traveling to the States, which cuts off a huge potential financial revenue source or having to make choices that feel really personally uncomfortable but are financially lucrative, and that takes a toll on its mental health. So I'm thinking about our musicians, and I'm thinking about our music industry, especially in this province. We just had the ECMAs, and so some of it is also, let's get some mental health first aid in place. How do you know when you're struggling, and what are the places you can reach out? How can you see signs in a colleague or a friend who might be struggling, and what can you do about it? So even at its most basic, some education around, we know this is a problem, let's help you figure out what are some coping strategies, or at the very least signs to be watching for.
Dr. Hubbard, as you said, this study is continuing, so I have a feeling you and I are going to be speaking a lot more about this. I know a lot of musicians. I know that some of them are struggling. You know, many haven't seen a pay raise in 25 years. What they pay in bars and clubs hasn't gone up in 20, 25 years.
But the stigma is still there. If you speak out and say, I'm someone who's struggling with depression, well, there goes your booking.
That's right.
Or
anyway,
that there's a potential or a perceived risk that that's what might happen.
Absolutely. Well, thank you so much for bringing this up, and we'll talk about more of this in the future for sure. Thank you.